Welcome back to another episode of Connecting Pathways. In the previous episode, we've been discussing on social anxiety disorder among children and teens, their symptoms and causes. In this episode, we'll be discussing on the diagnosis and treatment for social anxiety disorder. Your healthcare provider may determine a diagnosis based on physical assessment to help assess whether any other medical conditions or medication may trigger symptoms of anxiety. They discuss about your symptoms, how often they occur, and in what situations they occur. Treatment depends on how much social anxiety disorder affects your ability to function in daily life. The most common treatment for social anxiety disorder is psychotherapy, also called psychological counseling or talk therapy, medications, or both. Psychotherapy improves symptoms in most people with social anxiety disorder. In therapy, you learn how to recognize and change negative thoughts about yourself and develop skills to help you gain confidence in social situations. Cognitive behavioral therapy (CBT) is the most effective type of psychotherapy for anxiety, and it can be equally effective when we are conducting individually or in groups. In exposure-based CBT, you gradually work up to facing the situations you fear the most. This can improve your coping skills and help you develop the confidence to deal with anxiety-inducing situations. You may also participate in skills training or role-playing to practice your social skills and gain comfort and confidence in relating to others. Practicing exposures to social situations is particularly helpful to challenge your worries. Though several types of medications are available, selective serotonin reuptake inhibitors are often the first type of drug tried for persistent symptoms of social anxiety disorder. The serotonin and norepinephrine reuptake inhibitors also may be an option for social anxiety disorder. To reduce the risk of side effects, your healthcare provider may start you at a low dose of medication and gradually increase your prescription to a full dose. It may take several weeks to several months of treatment for your symptoms to noticeably improve. Your healthcare provider may also prescribe other medications as antidepressants. You may have to try several different types of antidepressants to find the most effective one for you with the fewest side effects. Then anti-anxiety medications. Benzodiazepines may reduce your level of anxiety. Although they often work quickly, it can be a habit-forming and sedative, so they are typically prescribed for only short-term use. Beta blockers. These medications work by blocking the stimulating effects of adrenaline. They may reduce heart rate, blood pressure, the pounding of heart, shaking of voice and limbs. Because of that, they may work best when used infrequently to control symptoms for a particular situations such as giving a speech. They are not recommended for the general treatment for social anxiety disorder. Don't give up if treatment doesn't work quickly. You can continue to make strides in psychotherapy over several weeks or months. Learning new skills to help manage your anxiety takes time, and finding the right medication for your situation can take some trial and error. For some people, the symptoms may fade over time and medication can be discontinued. Others may need to take medication for years to prevent a relapse. To make the most of treatment, keep your medical or therapy appointments. Challenge yourself by setting goals to approach social situations that cause you anxiety. Take medications as directed and talk to your healthcare provider about any changes in your condition. In our next video, we'll be discussing on some of the techniques to handle social anxiety disorder. Thank you and stay tuned.